Welcome to our presentation on PTSD. This presentation will focus on soldiers and veterans and the effect that PTSD has on their lives. So this is Leah, Heather, Ashley, Abby, and Lindsay. And yeah, we're excited for this presentation.
I have PTSD from serving my country. All I want to do is go back to Iraq to feel normal again.
I have PTSD from sexual assault trauma, and I'm worried that because of it, I won't ever be able to have a normal relationship.
I have PTSD and have nightmares every night, so I avoid sleeping as much as possible.
Today I was diagnosed with PTSD. Now I'm feeling more anxious and depressed about it. I'm not looking forward to the stigma that comes along with it.
I live with PTSD from Iraq every day. Nobody knows, they just think I'm antisocial, boring, and a bit strange.
I can't keep a relationship going because of my PTSD. There's gotta be a girl out there who's willing to look past it for me.
I have PTSD, and when people find out, they ask where I served. When I tell them I wasn't in the military, they dismiss it like I'm lying.
I have severe PTSD, but I'm afraid to get the diagnosis. I don't want a label, a handout, or sympathy. I just want help.
I secretly live with post-traumatic stress disorder. I try to act carefree, but I live on alert.
I hate it when my PTSD acts up, and I'm suddenly afraid of everyone.
My trust issues make everything so hard, and I wish I could just forget my past. But my PTSD makes it impossible.
My ex left me because I have PTSD and wouldn't open up about my deployment.
My PTSD makes me feel alone and unwanted, which makes me angry at people.
PTSD has made me a prisoner in my own mind.
I thought my PTSD was getting better, but then the flashbacks started up again. I'm exhausted.
I have PTSD. My service dog saved my life. He gives me unconditional love and a reason to live.
Post-traumatic stress disorder is characterized by intense emotional reactions, such as fear, helplessness, or horror. And it happens after exposure to a traumatic event like a threatened death, a serious injury, or a sexual violence. The diagnosis of PTSD is made based on the same characteristic of the symptoms that occur 1 month or more after the trauma. And it is common for post-traumatic stress disorder to be unrecognized for years.
Some major symptoms of PTSD is a person might re-experience their trauma, so they'll relive the ordeal through thoughts and memories of this trauma. These can include flashbacks, hallucinations, and nightmares. They may feel great distress when certain things remind them of the trauma, such as the anniversary of an event. They might experience avoidance. They might avoid people, places, thoughts, or situations that may remind them of the trauma. This can lead to feelings of detachment and isolation from family and friends, as well as a loss of interest in activities that the person once enjoyed. Or hyperarousal. They might have excessive emotions, problems relating to others, including feeling or showing affects, difficulty falling and staying asleep, irritability, outbursts of anger, difficulty concentrating, or easily startled. The person may also suffer from physical symptoms such as increased blood pressure and heart rate, rapid breathing, muscle tension, nausea, and fatigue.
Some risk factors are intense or long-lasting trauma, trauma or something that happened earlier in life, other mental health problems that they may have, lack of a support system, being a female, first-degree relative with mental disorder or other or PTSD as well, and abuse or neglect as a child.
So some characteristics of soldiers that have with traumatic brain injury could be engaged in high combat intensity, injured by a blast, They could experience more than one explosion. They're younger, lower rank, and male.
So some diagnostics that we can do to determine if someone has PTSD. First, we'll want to do a physical examination to see if they have any other health or medical issues that could be causing their signs and symptoms. We want to rule out that first if possible. Then we'll want to do like a psychological evaluation and ask them about their signs and symptoms and how they're feeling, and ask what maybe triggered the event that occurred. We'll want to use the DSM-5 criteria and ask them questions to see if they're showing any of those major signs and symptoms, like they can't sleep or have nightmares, or they're startled easily.
Some common comorbid disorders that occur with PTSD are substance abuse, anxiety, depression, or traumatic brain injury.
Treatment for PTSD consists of antidepressants, which help with depression and anxiety. Some examples of that are SSRIs, Zoloft or Paxil approved. There are anti-anxiety medications, which relieve the anxiety that are related to the problem. There is a potential for abuse, so you're supposed to use those for a short amount of time. And then there is intensive cognitive behavioral therapy, or CBT, which is found to be the most effective treatment for PTSD, both in short-term and long-term. Focuses on identifying, understanding, and changing thinking and behavior patterns. There is exposure therapy, exposing them to the trauma, memory they experience in the context of a safe environment. There's cognitive restructuring, make sense of bad memories or realistic perspective on the trauma. Eye movement desensitization and reprocessing combines exposure therapy with a series of guided eye movements and help process traumatic memories, change how you react to them. And then there is yoga, which is exercise in general is good for the mind as well as the body. Yoga has proved to be just as beneficial, if not more beneficial, than other types of exercise. Yoga can lower cortisol and stress levels.
Some nursing interventions or implications that us as nurses can implement would be establish rapport with the client to gain their trust. The nurse should be consistent, positive, and honest, as well as adapt to the non-judgmental attitude when working with that client. Providing time and opportunity for a client to express his or her feelings, it's essential that the nurse should detect any ongoing grieving process and help the client to find a conclusion. Another one could be to manage outbursts of anger, assist client to identify the sources of the anger or the emotions. And then also help them regain control of their emotions. Assist client in using displacement whenever he is angry by providing things he or she can manipulate or destroy, such as like clay or Play-Doh or something like that. Every outburst, or after every outburst, discuss how the client, discuss with the client how the anger escalated, desensitize the client to those memories of the traumatic event, administer a prescribed medication that could help with the memories, evaluate his or her response to the medications and if the client is taking or not taking them. Remind the patient that setbacks on the process of treatment are not failures, but they're all part of the therapy. Encourage client to accept forgiveness from himself or others. Emphasize with the client the importance of strict adherence to the medications. Refer the client to other sources of support, such as community organizations and support groups. Also encourage the client to express his or her anger verbally rather than physically.
So some goals of treatment are to prevent the primary symptoms such as nightmares or avoidance, and we also will want to improve their function, find ways to help them sleep at night, find ways to help them engage in social activities. We want to relieve the comorbid symptoms and strengthen their resilience. And we want to help them prevent relapse. We can suggest, like Ashley said, support groups and the importance of adhering to their strict drug regimen as well.
So thank